What if you have horizontal canal BPPV? Would you still do an Epley maneuver? The short answer is no. My name's Amy. I'm a vestibular physical therapist, which means I treat vertigo-related conditions such as BPPV, also known as positional vertigo. This is part 18 of my BPPV series, where I will tell you all about horizontal canal BPPV. The thing you need to know about BPPV is that there's two basic types. There's vertical canal BPPV, and then there's horizontal canal BPPV. The canal name in the diagnosis denotes which of the canals has the debris free floating inside of it. The vertical canals make up 98% of cases of BPPV because when we're upright, the bottom one looks like a drain trap under your sink, and it's a catch-all for any debris that breaks loose. And for the most part, with a few nuances, the vertical canals are the kind that gets treated with the Epley maneuver. The horizontal canal only makes up about 2% of cases because you have to be inside lying whenever your crystals break loose, and you have to roll in the exact correct way to make them fall into the horizontal canal and get stuck there. Symptoms of horizontal canal BPPV are very similar to that of vertical canal BPPV. However, there's a few notable differences. In general, with horizontal canal BPPV, you will feel horizontal spinning. That is like you're being roasted on a spit towards your right side or towards your left side, as opposed to vertical canal, which is more diagonal and vertical. While spinning symptoms will be kicked off by a head movement and last 10 to 30 seconds, just like with vertical canal BPPV, those specific head movements with horizontal canal BPPV include looking up, lying down flat, or rolling either way whenever you're in bed. And finally, and most notably, with horizontal canal BPPV, when you're lying in bed, your symptoms of spinning will change directions whenever you roll over. So for instance, if you roll to the right, you may feel spinning to the right for 10 to 30 seconds, whereas when you roll to the left, you may feel spinning to the left for 30 seconds. And vice versa. When you roll right, you may feel spinning to the left, and when you roll left, you may feel spinning to the right. The key here is that it changes directions. Horizontal canal BPPV is much more difficult to diagnose and treat and will require a professional and probably several weeks of vestibular rehab for a lot of reasons, but here are a few. It's really hard to tell which ear it's in because whether you roll to the left or to the right, both of them cause the crystals to move. So it requires significant clinical assessment to be able to determine which ear even needs to be treated. It also requires usually more than one maneuver in sequence to be able to get these crystals out of the horizontal canal and clear it completely. And the sequence at which you do it has to be decided in real time based on clinical information and has to be done in the perfect sequence or else it is not going to work. There are dozens of maneuvers for the horizontal canal alone. It usually requires several sessions of maneuvering to get the horizontal canal fully cleared. Symptoms during horizontal canal BPPV maneuvers are usually much more severe than those of vertical canal. Many times the patient has trouble tolerating them and is vomiting. They also will have more trouble with walking and balance during and after treatment. And finally, and most notably, after clearing the horizontal canal, patients tend to have more severe and widespread and longer lasting symptoms after horizontal BPPV as compared to those with vertical canal BPPV, so they'll require some vestibular rehab to get back on their feet. If you have horizontal canal BPPV, you can expect at least 2 to 4 weeks of vestibular rehab. So in summary, if you suspect that you have horizontal canal BPPV, best to leave it to the professionals. Get with your doctor or your vestibular PT to treat this very complex condition.